Welcome to Better Than Ever Live. My name's Dr. David Geier. Wherever you're watching, wherever you're listening, I hope you're making today and this holiday season your masterpiece. Again, my name, Dr. David Geier, double board certified orthopedic surgeon, sports medicine specialist, and media medical expert. I help you feel and perform your best regardless of age, injuries, or medical conditions. Thank you so much for being with us today. I apologize. Last week I was out of town on Tuesday. I told you I wasn't going to be here then. Amal, good to see you. The problem was Thursday I was planning to do the live show, and then I had a leak in my house and the repairmen were banging on all the pipes and the walls. It would have been horribly distracting for you watching this, and so I at the very last minute decided not to do it. But I am here today. I will be here Thursday, and I will be here next Tuesday. I'm taking next Thursday tentatively at least off. Also, if you cannot tell, I am under the weather. I am struggling with a cold now for about 2 weeks, and actually most of the congestion's gone, but I am losing my voice for whatever reason, so I apologize on the front end of that. And Vaishnav, and I apologize if I'm saying that wrong, I will give you an answer toward the end of this show. I think that's kind of interesting. As always, what we're going to talk about, and we have a lot to get to, specifically about mental health and about sleep. That's sort of the gist of what we're going to talk about today. But as always, I am not giving you specific medical advice. It's meant for general information and educational purposes only. If you have any specific medical questions or medical concerns, please talk to your doctor. If you want to see me, I see patients in Charleston, obviously, where I am here, and I see people in Charlotte, North Carolina. So you can go to my website, drdavidgeier.com, and there's a contact form, and you can find out about how to do that. But let's go ahead and get into it. We're going to talk about something near and dear to my heart, and that's the field of medicine. Obviously, I have been an orthopedic surgeon now for going on, let's just say a long time, well over a decade. And one of the things that's interesting about the field of orthopedic surgery is that it's, I don't know the exact number, but I'm guessing somewhere 97, 98% male. Very few female orthopedic surgeons. The ones that are typically hand surgeons and a few sports medicine, a few joint replacement, things like that, but there just aren't that many females. Now, obviously, medicine, that's a little different. Throughout all of medicine, that is a little more balanced. But there was a new study published in the journal Health Affairs that shows that women in medicine, female physicians, over the span of a 40-year career, make about $2 million less than the men do. The women make about $2 million less, basically about 25% less. What they did, and this was from 2014 to 2019, so this doesn't even include the pandemic, and that may have actually made the problem worse, but they looked at a simulated 40-year career based on women in different fields and men in certain fields. On average, men over 40 years, male physicians made $8.3 million compared to $6.3 million over 40 years for women. Now, that somewhat is related to specialty. Generally, there are far more male surgeons than there are female surgeons for all sorts of reasons. In orthopedic surgery, that's thought to be largely, it's typically former athletes. It's a lot of big, strong guys because a lot of the surgeries are very physical. But that's not exclusive. When they sort of factored out and sort of accounted for specialties, it was still that difference still existed. Male surgeons made $2.5 million more than female surgeons. Part of the problem, too, is thought to be generally females tend to go into primary care, which makes less. That's your family medicine, your pediatrics, your internal medicine, your OBGYN. But it's also that studies have shown women tend to spend more time with patients than do male physicians. So that could be part of it. But what's really interesting about this is that, and it's not, you say, well, it's all of science fields, but it's not. I mean, there is a difference in computer science. There is a difference in engineering, male to female, but not nearly as much in medicine. So there's something specific about medicine. And this is where what's interesting is where the salary gap occurs. Over that 40-year period, It's from the very beginning, from when men and women start their medical careers, after residency, after fellowship, if they do a fellowship, for the first 10 years, there's a big gap between men and women. But after 10 years, the gap stays about the same. Well, why would that be? Well, let's think about how old physicians are when they start their practice. After med school, you're at the very earliest, you're around 26. And then residency is anywhere from 3 to 6 years. So that's 29 to 32. That's about when women, if they're going to have children, that's about when they start trying to do that. Is that, late 20s to 40. That probably accounts for much of the gap. Then they get back in the workforce, but they're trying to balance childcare and all of this other kind of stuff. That seems to be the big difference. Now, I'm not 100% sure what you do about that, but it is kind of an interesting thing to know that women have a huge disparity when it comes to how much money they'll make over the course of their career. Along the same lines, a new study shows that female physicians and female healthcare workers much more likely to suffer burnout than male physicians and male healthcare workers. Now, one of the things you might not know about me specifically is that I do a lot of keynote speaking, and one of the topics I speak about is burnout. I went through a period of burnout in my medical career roughly around 2012, and it took me a long time to sort of work my way through all of the issues and kind of get back on track. But it's a real problem, and this problem, COVID-19 and the pandemic, are going to make that worse for sure. But it's not just that. It existed before that, and it's being asked to see more patients in less time. It's feeling like you don't have any that you're not valued in your work by the powers that be, the hospitals, the insurance companies, the companies that run the clinics. It's thought to be doing medical records in the middle of the night and all your other demands and being accessible 24/7 and having to respond to patients calling at 11 at night. There's a whole lot of factors. I could go down a rabbit hole of issues with burnout generally, but a new study in The Lancet, which is one of the big internal medicine journals, nearly half of female U.S. healthcare workers, 49.4%, experienced burnout compared to only 41.5% of men. The female healthcare workers much more likely to experience anxiety and depression, and they're much less likely to say that they feel valued in their work. And some of the reasons that burnout was more common in the females in this study, again, the gaps in pay, the gaps in advancing in your careers, basically climbing the ladder academically and every other way, issues with family and child care, and that type of thing. Here's the issue with burnout. And you may be like, well, why is he talking about this? I don't work in medicine. Why do I care? Here's where it matters. Burnout's bad for everybody. It's obviously bad for physicians, but it's bad for patients. It leads to lower quality patient care because you lose that doctor-patient relationship if doctors just aren't into it mentally and emotionally and everything else. It leads to doctors making more errors. Basically, burned out physicians make more errors. That leads to medical malpractice. It's driving physicians out of medicine. By, I think the year I remember, the last study I saw on this, by 2025, just basically 3 years away, we're expected to have a physician shortage in this country of almost 100,000 physicians. A huge problem, especially in your rural areas, and in your primary care fields. That's going to be especially hard hit. And then it just costs the system money. All the physicians leaving, the turnover, the lost shifts. We're talking billions of dollars, and that doesn't even include issues with malpractice, less satisfied patients. So this is something we've got to address. And I'll be honest, as far as why it's women more than men, it's going to be tricky to address that specifically. People have suggested things like, childcare and a variety of different things to help them sort of integrate back into the workforce and maybe alleviating some of the practice demands. But until you get this issue of seeing more patients in less time and all the different factors, the electronic medical records, that your doctor visit may only be 10 minutes, but your doctor's probably spending far more than that just entering the information into a computer. All of these types of things are going to have to be addressed, I feel like, or you're going to have a problem where what I see coming is, again, you're going to have 90 to 100,000 physicians leaving. That's going to be predominantly female. And then again, those are a lot of your primary care physicians. And so that's going to be a really, really tricky thing. All right. As far as, well, some of this applies to medicine. I don't know if any of you work as, I have a step stool in front of my desk that I keep tripping over because I pulled it out for something. Sorry about that. I don't know how many of you work night shift. And there are people in healthcare that do that, the ambulance drivers, the EMS folks, but it's people who work at grocery stores stocking. It's people who work in hotels, law enforcement. There's all kinds of people, truck drivers. There's all sorts of people that work in the middle of the night. And we know generally that's bad for your physical and mental health, in terms of depression, mental health, depression, anxiety, but physical health, things like diabetes, things like obesity, things like cardiovascular disease. And the question is, what do you do about that? And so there was a study, fairly interesting actually, a study in the journal Science Advances, where they took it's a small study. They only took 19 people, young people, and put them through 14 days of simulated night shift work. And again, this is the 11 p.m. to 7 a.m. type shift. But what they changed, they had them do 2 of those 14-day shifts, but what they changed is one group ate at night and one group ate during the day. And what they found was the ones that ate during the day did not have big spikes in their glucose levels, and that essentially put you at risk for type 2 diabetes. And what they feel like the problem, at least as it pertains to metabolic health and night shift, is that working and being awake in the middle of the night and then eating in the middle of the night messes up your body's circadian rhythms. Your body is used to getting its food during the day, being awake when it's light outside and then winding down at night. And it looks like it might be better if you eat during the day. Now that may be tricky for somebody that works the night shift, because if you're doing a lot of physical work, you may get hungry in the middle of the night, but it may be something to play with. I will say, and one of the I've already sort of written out some topics that I'm going to discuss on TV. I'm the medical expert for 2 TV stations here in Charleston, and one of the topics I'm going to talk about next week is a study that talks about eating during the day versus eating at night for all of us. And it looks like from a metabolic health standpoint, not just shift workers, but for all of us, it's better to eat in the waking daylight hours than it is at night, in the nighttime hours. So it's something to think about, and I'll talk about that on this show maybe next week as well. But if you are a shift worker, you might think about trying to eat maybe before you go to work while the daylight's out there, kind of keep your body as best as possible on its normal circadian rhythms. All right, last one about mental health. And that's about college students. There's a new study out looking at first-year students at a public university in Canada. And these were researchers at Oxford. But what they found out is that 1/3 of college freshmen have anxiety and depression. Stunning number to me. What they found out is that after 6 months of being enrolled in school, and they surveyed these people at the beginning and then again 6 months into school, but by the time they were 6 months into their freshman year, 37% of the college freshmen had anxiety symptoms, 33% had depression symptoms. Now here's where I think it gets kind of interesting. The students that were using illegal drugs, and it doesn't specify what types. I don't know if those are stimulants like Adderall and things like that, or if we're talking, opioids and things like that. But the ones that used illegal drugs, significantly higher levels of anxiety and depression. But the students that had the lowest risk of anxiety and depression were the ones that were socially active, clubs and sports and things like that. And what they think is going on is that college is a time of loneliness. It's very easy. You go to class, you go back to your dorm, you go somewhere and you study, and you're not necessarily doing a lot of social stuff. Now, the people that are involved in clubs and sports and other extracurricular activities around other people, less likely to have loneliness. And again, loneliness is not just associated with mental health, even though that's easily been tied, but it's also been involved in things like cardiovascular disease and obesity. So I think that this is a sign that we need to address this in our college students. One, I can tell you now, maybe this is better, but when I was in college and I went to student health a couple times, it was basically a nurse practitioner supervised by a primary care doctor, but it wasn't a lot of attention to mental health as far as I could see. Maybe that's gotten better, but we need more attention to student health. Let them know there are resources, people that they can talk to. But also, promoting getting involved in extracurricular activities seems to be one of the relatively easy ways, however you can encourage that, to lower the risk of anxiety and depression and improve mental health of college students. And I've got to think that that's particularly important now with all the colleges closing down, or at least temporarily going online. Mental health at the college level, university level, is going to be really, really challenging in the next couple months. All right, we're going to pivot a little bit to sleep. And sleep is closely tied to mental health, but that's not necessarily what we're going to talk about now. We're going to talk about how you get better sleep. When I haven't done this in a while, but a couple of years ago, 2-3 years ago, I was a member of this business. I don't know what else to describe it, but they did recovery modalities. They had a cryotherapy chamber, they had infrared sauna, they had the Normatec compression boots, and a couple other things. And I would, you pay a monthly fee and you go as much as you can. And I remember one of the girls working there, because when you're in that cryotherapy chamber and it's like 165 degrees below zero Fahrenheit and you have to stand there for 3 minutes, the only way to really get through that is to be talking to the person. It sort of distracts you into not thinking how cold it was. And I remember one of the girls telling me that she struggles with sleep and that she started with using CBD oil to fall asleep, but then it got to be, trying to use marijuana to help her sleep. And I know, I don't know how you feel about this, but I have heard many people in my life talk about that marijuana helps them sleep. Well, turns out that may not actually be all that helpful for your sleep. In a study that was published in Regional Anesthesia and Pain Management, or Pain Medicine, a group of researchers at the University of Toronto looked at cannabis, marijuana, and sleep. They used data from the National Health and Nutrition Examination Survey, a huge population-based study in the U.S., hundreds of thousands of people in it, and it tracks everything they eat and all sorts of other factors in their life to try to make conclusions about what effect that has on your obesity or heart disease risk or longevity. There's all sorts of studies based on this NHANES data, but they found in data of over 22,000 people, or almost 22,000 people, what they found is about 1 in 7 of those people used marijuana, cannabis, over the prior 30 days. They were much more likely than people who didn't use marijuana to either not get enough sleep or to sleep too much. And the reason this matters, one of the tricks with sleep is it seems to have what we kind of consider a Goldilocks effect. You can have too little, which we know is bad for your health and cardiovascular disease, things like that. You're getting 4 or 5, maybe 6 hours of sleep a night. But actually having too much sleep, getting more than 8 or 9 hours of sleep every single night, is actually bad for you in the same way. So there seems to be sort of a window that you want to try to get. But people who used marijuana, more likely to be in either side. They either didn't get enough or they got too much. But they also had more likely to have trouble falling asleep, more likely to have trouble staying asleep than people who didn't use marijuana in the prior 30 days. And then when they looked at people who were moderate to heavy marijuana users, more than 20 days each month, much more likely to either not get enough sleep or to get too much sleep. So really, there's no take-home point, but if you're thinking about using marijuana because it's going to help you sleep, you might want to talk to your doctor about that and see if maybe there is another alternative. I can't say that I have any significant thoughts. Robert, hey, how are you? And I see a couple questions in here. I will get to those toward the end of the show. But just something to maybe talk to your doctor about. All right, a couple weeks ago, before I was out last week, I talked about a study that said if you have certain kinds of dreams, you might have sleep apnea. And if you don't remember, sleep apnea is the condition while you're sleeping, your airway gets, the muscles relax and they constrict your airway. You don't get enough oxygen, you struggle to breathe. And one of the interesting things about sleep apnea is a lot of people don't know they have it. Again, because it happens at sleep. But they wake up throughout the night, they're not rested, so they feel groggy during the day. But sleep apnea has some negative health effects. It's related to high blood pressure. It's related to abnormal heart rhythms. It's related to abnormal heart function and heart failure, stroke, diabetes, or risk for diabetes. So it's something you definitely want to know about. And one of the things that's thought to be the best predictor of obstructive sleep apnea is body mass index, or being obese. But it looks like there may be another factor. And no, not just bad dreams, even though that is interesting that if you have dreams, if you remember go back and watch the video, but if you have dreams that you feel like somebody's choking you or strangling you or feeling like you're drowning, that may, according to that study, may be a sign that your brain is trying to tell you you've got sleep apnea, so you should talk to a doctor. Here's another reason you might get checked for sleep apnea. If you have a big, wide, thick neck, you very likely may have sleep apnea, according to the study out of the Mayo Clinic. If your neck circumference is over 17 inches in men or over 16 inches in women, that's a very good sign, apparently, that you might have sleep apnea. Now, men typically know their neck size. If you wear a dress shirt at any point, it tells you you're a 15 and a half or whatever your neck size is. I doubt women tend to know that as much, but that may be something you think about. All right. Sleep is definitely very important for you for a variety of reasons. But one of those is it's good for your mental health. If you don't get enough sleep or don't get good quality sleep, you have a higher risk of depression. So how do you work on that? Well, it may be simply not getting more sleep. It may just be shifting when you sleep. There was a study at a University of Colorado, MIT, and Harvard. They looked at over 800,000 people. And what they found is if you just shifted your going to bed and waking up times earlier, you cut your risk of depression by about 25%. What they basically found is, looking at, again, these 840,000 people, about 6 a.m. was the ideal wake-up time, and if they got 7 hours sleep, that was best for, or lowest risk of depression. But what they found, so all you had to do was shift it back an hour. So if you normally go to bed, let's just say at midnight, and you wake up at 7 a.m., that's going to have X amount of risk of depression. But if you shift that where you go to bed an hour earlier, you wake up an hour earlier, so you sleep the same amount of time. You go to bed at 11, or fall asleep at 11, I should say, and you wake up at 6. Even though it's not a difference in the overall amount of time, you lowered your risk of depression. And so they talk about some of the possibilities. More exposure to daylight. Remember, you want to be awake during daylight hours most of the time and not getting up super early or staying up super late. But it's thought to be that and your circadian rhythms, and maybe it affects your hormones. I actually have, so that all may be true. I have another theory, though, as to why getting up earlier and going to bed earlier might lower your risk of depression. You're more likely to get stuff done, to be productive. Darren Hardy, I don't know how many of you follow Darren Hardy. He used to be the publisher of Success Magazine and now is a business coach and that kind of thing. He talks about this, but a lot of people talk about this. All the good things that you do, career-wise and productivity-wise and health-wise, occur in the morning. That's when you get, maybe if you're writing a book, that's when you get some of your book done, or you go for a run, or all the good stuff. The bad stuff is what comes out at night. You eat stuff you shouldn't eat. You watch TV shows or movies you shouldn't watch. You drink what you shouldn't be drinking. You text people you shouldn't be texting. All you have to do to improve your health and probably improve your career, move that back an hour or 2 hours if you stay up real late. Get rid of all the bad stuff at night. Have a few extra hours maybe before the kids get up, or an extra hour, and get stuff done. I feel like that probably is a whole lot of the issue with depression. Not all, I can't prove that, but I suspect there is something to that, not just your circadian rhythm and hormones. All right, last two on sleep, and the second one I'm excited to talk about. But the reason all this matters is that if you sleep better, it's just good for your physical and mental health. There's just no question about it. And so there's a new study that looked at all the different ways getting a good night's sleep was good for your health. What they did, these researchers didn't just measure how long you slept. They factored in things like how consistently you went to the bed at the same time every night, how consistently you woke up at the same time every night, how long it takes to fall asleep, how often you're sleepy during the day, problems like snoring and difficulty breathing while you're sleeping, and they came up with an overall sleep score, basically a study of your sleep health. What they found then, people that had good sleep health, this is compared to people who had overall poor sleep health, those with good sleep health, 66% less likely to have high blood pressure, 58% less likely to have type 2 diabetes, 73% lower risk of obesity, 69% lower risk of having abdominal fat. When you broke it down into even some of the specific components, the people that don't have trouble falling asleep or they're not sleepy during the day, again, much lower odds, type 2 diabetes, high blood pressure, obesity, and body fat. So it's critically important that we do what we can to get our sleep better regulated. So again, and I've talked about all sorts of different ideas, things like going to bed around the same time every night within about a 30-minute window, waking up at the same time every day, making your room as dark as possible, not exposing yourself to screen and other blue screens like TVs, phones, tablets, things like that in the hour before you go to bed. Not a lot of noise, no caffeine or alcohol afternoon or night if at all possible. Not eating a big meal right before you go to bed. All of those things can really help get that sleep under control. It's not going to be just good for you feeling rested. It's going to be good for your overall health. All right, and then last, this is something that is probably not going to appeal to that many people. I don't know, maybe I'm wrong. I think this is fascinating. So there is a study that looked at a sleeping technique of there's two listed in this article. There's probably not the only two people that do it, but one's a famous artist, Salvador Dali, and one is a famous inventor, Thomas Edison, and they both used this sleep technique, and they did it not to feel good or have improved mental health or anything like that. They did it to boost their creativity, and the technique goes like this. I think this is fascinating. They would fall asleep in a chair holding something, a spoon, a ball, something like that. As soon as they fell asleep, they would drop the spoon, drop the ball, it would make a noise and wake them up. As soon as they did that and they got woken up, they would get to work. And why they did that is it would boost their creativity. Good for an artist like Salvador Dali, good for an inventor like Thomas Edison. So the question is, one, what's going on? And two, would that work for the rest of us? Well, there was a study done, what journal was this? Science Advances. They took 103 healthy people that could fall asleep easily and had them do these sort of math type problems where there was an 8-digit sequence of numbers and they had 7 of them. They had to get the 8th one, and they gave them 2 mathematical rules to figure it out. But there was sort of a third hidden rule that they didn't tell the people, which is the 8th number is the same as the 2nd number. If you knew that, then you could figure it out really fast. Well, they had these 103 people try to do these math problems, and there was like 10 math problems, trying to figure it out using the two rules, and it typically took them, how long? Well, it took them X amount of time. But then they had those same people do it where they did the Thomas Edison, Salvador Dali technique, where they basically, and they had EEGs to measure their brains to know when this was happening, but they would hold something, as soon as they fell asleep, the object would fall, they'd wake them up, get them on the math problems. The ones that fell into a very specific state where they just fell asleep, but then they were woken up, 83% of them figured out that hidden rule, that the 2nd number was the same as the 8th number, whereas the ones that didn't fall into that phase of sleep, only 30% figured that out. So a huge percentage got what was considered creativity. They figured out a novel, unexpected way to solve a problem. So what's going on here? Well, apparently, in the very first few minutes you fall asleep, and this is typically only about 5 minutes or so, that you enter a sleep stage called N1, or a state of what's called Hypnagogia. And this is thought to be ideal for creativity. But it only lasts a few minutes before you go into a deeper sleep. So this is where you can see shapes, you can see colors, and even have some dreams, but you can still hear what's going on around you. It's fascinating. They talk to people that did enter that state, because again, remember, they were monitoring their brains with EEG. Some of them very quickly went into deeper sleep, and that was what was funny. The ones that were in that N1 or Hypnagogia state, but slept a couple more minutes and got into deeper sleep, were not more likely to get the creativity boost and figure out that hidden math rule. It was just the people that were woken up in that state of hypnagogia. Let me tell you some of the things that the people that did successfully enter that state, some of the things they said. One said, "At one point I saw a horse in a hospital." Another one, "There was a man doing the same experiment as me who was much older and had kind of a plastic helmet on his face." Another one said, "I felt like I was at the water's edge, no wind, airy sounds, like they were in a forest in summer." Some people saw colors, some saw shapes. Some even said that they had a feeling of that math problem, even though they couldn't actually figure out specifically in that dream what helped them figure it out. But again, the key was being woken up as you were in that state. And I don't know necessarily how you could use that, short of Edison and Dali's thing where you sit in a chair holding a cup or a glass or something and it falls and then you immediately wake yourself up. But if you're a writer, if you're an inventor, if you're an engineer trying to solve a problem, there's all kinds of potential creativity problems. But the key, again, is that you've got to wake up and go immediately to start working, because once you go into a deeper sleep, you may lose the benefits of that. How many of you would consider trying that? I would, but I'm not necessarily, and I've written a book, so I'm all in favor of creativity. I'm not convinced I could pull that off. Once I start to fall asleep, I don't know how well I could just wake up and start working, short of having to make a cup of coffee and kind of stimulate myself. I don't know. So if you have any thoughts or questions on that, certainly let me know. I said I was going to go through some of these questions. Vaishnav, I don't know how you say that. Yeah, I do remember that video. I don't remember at the time, but I'm going to assume it was, just because it's what I usually use, that was a Dial body wash, but I may be wrong about that. Nighttime cravings are very strong. Yeah, that's from Robert. My issue, so I've talked a little bit about fasting, how I like to do intermittent fasting, but occasionally I'll do 3-day fast or 5-day fast. If I ever break it, it's because I lose my willpower at 9:30, 10 at night. That's where I really struggle with that. Vaishnav, high amount of fiber in our body. Not 100% sure what he's asking there. I'll read that later and try to get an answer for you. He also asks about something to increase stamina, and I don't know necessarily if that's physical stamina. He's talking about weight and jogging and things like that. One of the things about, and I don't know if this necessarily applies to stamina. I don't think it's been studied, but he talks about weight and physical activity, that there are ways to increase muscle mass through growth hormone releasing. So there's human growth hormone that you can take exogenously. I'm not super excited about that because it's got a lot of issues with joint pain and fluid retention and carpal tunnel syndrome, but it can increase abdominal fat around your, visceral fat around your organs and a number of other things. So I'm not big on human growth hormone, but sometimes you can increase muscle mass sort of naturally with a growth hormone releasing peptide, a peptide that basically causes your pituitary to release growth hormone that it's already making. So it's a more sustained, steady release, and that could be good for muscle strength. And there's a number of those that do that: AOD 9604, CJC 1925 with ipamorelin or hexamorelin or tesserelin, a number of those. So that may be something to talk about. I don't know if that necessarily helps that much with endurance. There's a lot of cardiovascular and exercise training methods that can do that as well. That's probably beyond what we're talking about here. Thank you so much. I'm going to wrap it up because I'm, like I said, a little under the weather. I will be here Thursday with some really interesting topics. If you have questions, join us then. If you're listening to this on podcast and you want to comment, definitely join us on YouTube, youtube.com/Dr. David Geier. Ring the bell to be notified when I'm on live. If you're watching this live, but you're going to miss us, subscribe to Better Than Ever Live wherever you get your podcasts. If you know people that have an interest in health and wellness and want to live longer and feel better and do everything they want to do as long as they want to do it, have them join us on this show. Send them to youtube.com/Dr. David Geier. That's where I do stuff most consistently. But any of this, have them join us. We'd love to have you and have more people in this community. Thank you so much. I will see you right here, same time, Thursday afternoon.